The big companies have marketing, which is very expensive. They go through all sorts of legal procedures. They're being fined all the time, and they're paying out large legal fees and large fines. All of this overhead will still exist with the insurers. They make a profession out of violating the law, and they wouldn't do that unless they made money on it. And employers under that kind of health care plan will continue to cut back on employee plans because they will become more expensive, continually more expensive. We've already dropped almost 10% of the employer-employee plans. It's down to something like 60 from 69% of employers. So those are some of the negatives, and I think people have to make up their mind what is important here. And also one has to think of the context in which this is happening. It's a context in which the corporations have called the shots. You did not call the shots. It is not a popular democracy that we're dealing with. Now, after signing, assuming Obama signs, I think we have to go to work with renewed energy to get a single-payer bill. Now, at first, it may make sense to go at the state level, whether or not the Kucinich Amendment passes. Our organization in Indiana started out at the state level because we saw no hope in Washington of doing anything. And we have to make unions a very important part of this. And we also have to expect the unions to live up to their pledges to support single-payer health care, rather than say, oh, we support it, but now we want to please the president to keep our foot in the door. Students don't think much about matters of life and death. They think they're invincible. And we've had very poor luck in engaging students in the healthcare movement. Maybe you've had better luck. But this is one of the things I think that campuses around the country, people on campuses need to emphasize. We want to get those people involved in this movement. We want to get back to the point where they see the importance of having a solidarity society. Furthermore, we're not just content with resolutions, we have to be in the streets. We need to emulate the raucous people. You remember Dr. Fowler and her colleagues who got up from Physicians for the National Health Program in the Baucus Committee and denounced it for having single payer off the table. And also the mobilization for health care for all, which is doing excellent work by establishing crime scenes at the doorways of insurance companies and getting arrested for doing it. And if you want something to do right now, Healthcare Now, which is one of the few national organizations, and we do need a national organization to coordinate all these other things. Healthcare Now meets in St. Louis on November the 14th and 15th to discuss healthcare policy for the future. So thank you for being a very attentive audience and listening to this stream of ideas.
Questions and comments. I know some of the people in this room, and they are capable of talking enthusiastically, sometimes for long periods of time. So if you'd like to ask a question for 2 or 3 minutes per question, make a comment, offer a different perspective, that'd be fine. And maybe we'll take, I think the way this usually works best in my experience is we take 4 or 5 questions and then ask Milton to respond to them. And I like this thing I've learned from computers that sometimes people establish a thread, So if someone establishes a first question and you have a couple other questions along that line, we might take that little group first and then start another thread, another idea. So any hands there? I see Justin first and then this gentleman and then you. I see three speakers. Go ahead.
First, I just want to make a comment that mobilization for healthcare has an action going on in Columbus tomorrow. If anybody has any interest, or if you know anybody in Columbus that would have any interest, I can give you the contact person's number. And I believe they're meeting at 10 o'clock, and they want people to be there by 10:45 at the latest. My question was, in your talk...
That's good to hear.
And we're actually going to try and get one organized here in Cincinnati. I've made that request. My question for you, Mr. Fisk, is you're talking about when Blue Cross and Blue Shield used to be not-for-profit and when there was a change. And I would like to know if you could describe when that change was. Was it under Nixon or?
It was a gradual.
So, should we take a few questions first?
Yeah.
I think it'll make it a little. Would you like to ask your question?
Yes. Is it Dr. Fisk?
Yeah. And could you remind me of your name?
Pardon?
Your name.
My name?
Yeah.
Or the gentleman behind me?
Oh, is it the gentleman behind you who's speaking? Okay.
No, go ahead.
The gentleman behind me who spoke first. Are you asking for his name?
No, I got his name.
My name is Jack.
Okay, Jack.
My question is, you have had a book published, the title of which suggests that you perceive the healthcare issue to be not just a political issue, not just an economic issue, which it is to the healthcare economists, but a moral issue. And I was hoping that you might have addressed that issue, that subject of healthcare reform as a moral issue in your remarks that you made, but you did not. So I'm going to ask you now to tell us how you would argue the healthcare issue, reform issue, as a moral issue. If you were to solicit signatures on the petition for the Healthcare for All Ohioans Act, and you wanted to respond to something that was said to you by saying, I consider the healthcare reform issue to be a moral one, how would you argue that?
Yes, sir.
My name is Dan, and today I heard that Harry Reid said that there will be a public option, but it will be up to the states. Does this mean he's going to give the states the option of either becoming members of the organization or opt out, and if they decide that they do want to give the program to the people there, where will the money come from? Then the second thing I want to ask about is, I heard also, I don't know who, I couldn't read, some news mentioned that one of the proposed programs is designed so that the people who are older, like me, and will have to pay more for insurance than people who are younger.
Fellow in the red shirt, did you solve your question?
In connection with the question about Blue Cross Blue Shield, what's wrong with pushing for a you point out that the inherent problem with a profit system. Why not push for a not-for-profit insurance system?
So that was the first group of hands I saw. Is any